Once it became clear that Avastin was effective for the treatment of wet macular degeneration, my colleagues Dan Martin and Stuart Fine organized a National Eye Institute study in which Lucentis was going to be compared with Avastin. This is a publicly funded study through the National Eye Institute of the National Institutes of Health, and it's a multi-center trial that took quite a long time to prepare and implement. That study is now ongoing. In the CATT, which stands for Comparison of Age-Related Macular Degeneration Treatment Trial, there are two arms. In the first arm, Lucentis and Avastin are compared when injected on a monthly basis for 2 years. In the second arm of that trial, Lucentis and Avastin are compared. Each drug is given once and then only given as needed based on the individual patient's response to the therapy. The rationale for these two approaches is as follows. In the phase 3 trial with Lucentis, patients were injected every month for 2 years. Since that phase 3 trial was started, we performed a trial called Pronto. In that trial, which was also sponsored by Genentech, we demonstrated that patients could be treated on an individual level, dosed as needed with the drug, and followed closely on a monthly basis. We found that rather than 24 injections over 2 years, we were able to get away with 10 injections, and our results were very similar to the results of the phase 3 trial. So we believe that we can dose less frequently and get the same excellent visual acuity results, and that's one of the goals of the CATT. So the CATT trial will compare monthly dosing every month for 2 years, Lucentis versus Avastin, versus one dose that only further dosing given based on an individual patient's response to therapy. So we'll know from this study whether monthly dosing is necessary or just dosing as needed is necessary.